Hello and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Zachary Schwartz. In this episode, we'll explore and share strategies to improve HPV vaccine uptake. We'll hear from Dr. Rebekah Fenton, who's an adolescent medicine physician, and Dr. Sharon Humiston, the director of the research at immunize.org and associate editor by Z Express. For more information on our faculty, along with a link to the larger educational program, please visit the show notes for this episode. Now let's get started with Dr. Humiston as she explores current barriers to HPV vaccination.
There are lots of ways to improve. We were talking about quality improvement in office strategies, and improving communication is what we're going to focus on today. But there are other ways. In a study that we did, the American Academy Pediatric Research in Office Settings, the AAP PROS, we did a quality improvement through that network and found that the most effective thing that we did was better communication. We also did prompts for providers from nurses and the EHR, which, helped some, sending parents reminders and giving HPV in acute and chronic visits. People found it very hard in offices to do that one. So we're going to focus just on the improving communication at first. There's lots of things. Reframing HPV expectations, that in teal you see the one about it's not about sex, it's a cancer. One of the things that sometimes work is explaining, parents that want to put this off, they might say to you, let's wait until they're older and then they can make the decision on their own when they're 18. But if they start the series on or after their 15th birthday, they need 2 doses instead of 1 dose. And so some people find that, especially when you explain that's because their immune system actually works better before they are a late teenager. When teenagers get older, a lot of times they stop coming into our office, that they're busy with this and that, and sports and work and friends, and so they stop coming. And so let's get it done while they're here now. And just explaining that it's time for your 9-year-old visit, your 10-year-old visit, your shots. If you use what they call a presumptive approach, where instead of saying, how do you feel about getting the HPV vaccine today? If instead you do it like you would with polio vaccine, where you just say, today you're due for HPV vaccine, that presumption that they're going to want what you're recommending is much more effective. This is out of 84% of visits where the provider made a recommendation. If the provider made a presumptive recommendation, they only resisted 26% of the time, where what they call a participatory, usually participatory sounds like a better approach, saying, like we want things to be more participatory. But if you use a participatory approach, like what do you think about getting an HPV vaccine today? 26% use that approach. And out of those, 83% of the families resist it. So the presumptive approach, where you presume that people are going to want what you recommend, is much more effective. I worry about the word presumptive approach because it sounds like presumptuous, and it's like, it sounds like I'm saying, well, of course, anybody with half a brain would want. And that's not what we're saying. It's just like what we do with, when I say, I recommend amoxicillin for this ear infection, this is what I recommend. It's my presumption that you're here because you want my opinion. Using a declarative statement based on the best medical information, use the same approach as you would. Okay, so assume willingness to vaccinate. And then if you're wrong and they don't want it, they will let you know. And that appeals to the majority of people. If you start with the presumptive approach, you're going to vaccinate a lot of people. So one way of saying it, now that your son is 9, he is due for vaccination to help him protect with HPV cancers. We'll give him that vaccine today. Just something straightforward. Another thing that we found in our quality improvement, that a lot of offices were doing this thing where if somebody said no to the vaccine once, that they put in the chart, don't ask again. And so it like closes the door on future vaccination. And so again, one of the things that we did was to have them say, if they say no today, you've done your spiel, say, I find cancer prevention so important that And I know that you have an open mind. And so you may change your mind. So I'm going to ask you again. And just asking again, a huge percentage will turn that around. Another thing is the importance of staff training so that everybody in the office is on the same page with this, so that you don't have anybody in the office saying, oh, you don't want it today, then we'll make sure we don't ask again. And this is also having everybody ready to understand the frequently asked questions. My son doesn't need this. My daughter doesn't need this. She won't have sex before marriage. Knowing the answers to those frequently asked questions so that you don't have an MA in your office giving misinformation, because that MA has a lot of power, because the MA may look more like the parent than you do. CDC.gov has a wonderful handout that has quick scripts for the frequently asked questions. Motivational interviewing. There's going to be a group of parents that you say, your child's due for the vaccine, and they just say, fine, whatever you say. Then there's going to be a group who say, well, I heard that it causes infertility, and you're going to give them a one-sentence answer to, actually, HPV infection causes more infertility than HPV vaccine. One-sentence answer. And then there's a group who are concerned and have a bigger concern. And so you are going to spend 3 minutes talking to them. And that's where the motivation will come in. But I just want to say also, there's going to be some people who say no, and that there has never been a study that I know of that shows a way for total refusers other than what we just talked about, leaving the door open for them to change their mind and asking at the next visit. So let's go to that group that have a concern but aren't total refusers. This is where motivational interviewing comes in. It's a patient-centered approach. The basic idea, you're not going to go through 3 days of a workshop on learning motivational interviewing. Most of us aren't, at least. But you can do a couple of little things, like getting people to talk about why they might be interested in an HPV vaccine. Avoid addressing the wrong concern. So you don't start by assuming everybody's main concern is safety. You start by asking so that you find out what their concern is. Nothing wastes time like addressing the wrong concern. And then avoiding what they call tennis facts, where, the parent says, I'm worried about this. And you say, no, this. And then, that kind of back and forth, it turns into a fight. And sometimes you can get people more entrenched in their anti-vaccine pose by playing fact tennis. And so we don't recommend that. Instead, if you get down to the point where you've explored the reason for hesitancy, then the next step is to ask permission to address their concerns. Now, I'm old enough that doesn't come naturally to me, but I've found that when I say, do you mind if I talk about my perspective on this? Nobody has ever said no. I have never had anybody who's not there because they want a medical opinion. They're all there because they want a medical opinion. So if I say that, just, in a very simple, fast, do you mind if I give you my perspective on this? That most people do say yes. And then it may be that my perspective doesn't change them, but at least I've had a chance to say it without being that push me, pull you. And then if they go down to step 5 and they still are saying no, leaving that door open, I'll ask, I think that cancer prevention is so important. I'll ask you again next time I see you. So I'm turning it over now to Rebekah.
I think actually Sharon demonstrated this beautifully. But again, just making sure that we are continuing that conversation and stating it as a statement and not a question. I think she also covered some of these things, and I'm glad that some people in the room are also already talking to 9-year-olds. I guess I will give the introduction that I'm adolescent medicine, so I only see people at 10. So thank you for starting this conversation before they're coming to me. I was in the thick of it, like many of you all, during school physical season, where we're talking to those 11-year-olds and really trying to get them to get their full shots that we would recommend, as opposed to the ones that just school requires, which often you hear. And so I love this idea of disconnecting this from once we're at 11, especially when we're talking to kids by themselves, like parents are knowing, like, oh, you're the doctor, you're thinking about sexual activity. My kid is nowhere near that, versus when you're having that conversation earlier. Like, again, similarly, we're not talking about why newborns are exposed to Hep B. So having those vaccines on board has huge benefit. So we're decreasing that stigma. We're, as we already talked about, the improved immune response and therefore getting less vaccines, as well as more time having them come in. At least within Chicago where I practice, you get a required physical at 14, and then at 16 you have to have your shots to be able to graduate. And so we're not seeing those teenagers for those routine visits, as opposed to at this age, they're still very used to like, oh, I have to have my annual checkup. And those are great opportunities to be able to vaccinate. I wanted to talk about, especially from my world of adolescent medicine, like where in the country, because I think this was one of our questions, that teens can at least choose to get vaccinated. So there are 8 states that allow adolescents to consent. I actually learned that my own was one of them, but the language is so odd. It basically doesn't clearly say they can choose to. It's more of adolescents can consent to practices related to their sexual health, including vaccines, which is all I need to now be like, okay, great. I can talk to you about your HPV during your HEDS assessment, even if your parent is very clearly like, no, we don't want this. We don't need this. Ultimately, we do realize that, of course, teens trust their parents' opinions, and that's why that education as a family is so important. But they do have that ability to consent in 8 states. In other states, again, adolescents can get consented at 18. And so just remembering that, yes, we're having all these conversations earlier on, but the thing I really enjoy is when you're finally seeing them at that 18 to 21 years old, you're able to say, hey, actually, now you are in charge of your health. Here's the reasons why this vaccine is still recommended. And we certainly saw the benefits that that has as far as their protection. So we're definitely still trying to get them vaccinated for that protection, even if it wasn't before their first exposure. And vaccination is available up to 45, but it is standardly recommended up to the age of 26. And so then as far as there are some very few places in the country that actually require this. And as you can imagine, their vaccine rates are also high as a result of that, because again, we're not having people parse out, oh, I'll take the 2 required versus the 1 recommended, but we're really getting all 3 or even more depending on their seasonal vaccine availability. And we have that those places are Hawaii, Virginia, DC, and Rhode Island, although some of those states do allow exceptions similar to other vaccinations. Right. So our key takeaways, as we talked about, just kind of that presumptive approach that, hey, it's time for these shots that we're offering, again, separating the sex from cancer prevention. And I will also say with that, I find that it kind of when you talk about some of the concerns, like there are certainly those parents who are saying like, oh, but my child's too young for that. And that's when I do acknowledge the elephant in the room that like, yes, we do know that this comes from intimate contact, but ultimately, again, going back to our points, we're not saying that they need this now. And I'll even say out loud, nobody in this room wants your child who is 11 years old to be having sex right now. But I knew though it's beneficial to have that protection now and that it's stronger protection for their future. And when I frame it that way, sometimes they're like, okay, this is not some kind of permission. And I'll even share that we've seen studies that show that just because kids are getting these vaccines at these ages does not mean that they're increasing their sexual activity, doesn't mean that they have more partners. All of that is totally separate. Again, we're just focusing on that cancer prevention. And we talked about the benefits of going before 15, as well as, again, the infrequency of visits.
Thank you, Drs. Fenton and Humiston, and thanks to you, our listeners, for joining us. As a reminder, to view the full educational program, please click the link in the show notes. And to get access to all of our new podcasts, subscribe to the CCO Infectious Disease Podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you, and we'll see you on the next podcast soon.